Welcome back. The Centers for Disease Control and Prevention released new data that shows U.S. maternal mortality rates are down all across the country. In 2021, the maternal death rate stood at 32.9. That was per 100,000 births. In 2022, though, that number dropped to 22.3 deaths per 100,000 live births. But it didn't necessarily drop in our area, in Harris County. So here to tell us more about the growing issue is March of Dimes Collective Impact Director, Alicia Lee. Thanks so much for coming on this morning.
Thanks so much for having me, Amy.
Yeah, I mean, we think about Harris County and Houston and all of our medicine and all of the technology and advances. I mean, so we didn't drop as much from 21 to 22, the number of mothers dying. Why? Do we know?
Yeah, so what we saw from the release of the Centers for Disease Control report on maternal mortality in the United States is that we have returned to pre-pandemic levels across the country. So the fact is we are still failing our women during pregnancy, and that rate that they showed us is the number of 818 women died in 2022. What we are seeing in Harris County is a number of women who are still dying, and we are failing our moms during pregnancy and after delivery. The rate that was published by the Harris County Public Health, our public health department, they showed the number of women who have died over the past through 1 year. And that CDC report shows women who've died from pregnancy through 42 days. So it's complicated. There are different numbers of how we look at maternal mortality, but we're still, too many women are dying. That's a fact.
I mean, and just so that people understand that you gave that statistic out, maternal mortality means when you're pregnant, if you die because of anything pregnancy related, or shortly after, like within 42 days of giving birth.
Correct, yes. So the World Health Organization has a definition for maternal mortality rate. And this allows us as the United States to compare ourselves across the world to other countries. And so that is the death of a woman while she's pregnant and up to and after 42 days from delivery.
I mean, so obviously we're seeing this in certain populations more than others. It's broken down by gender, by age, obviously by parts of the country. I mean, so what are we seeing here in Harris County in our area? What we can do, like which population, why are these numbers continuing to remain high?
Yeah, so what we are seeing in both Harris County as well as across the United States is that our Black women are dying at a rate of 2 to 3 times greater than our white counterparts. It shows that we have a systemic failure of our healthcare system that is failing these women and other women of color. And it's a complex issue. It's a multifaceted issue. But we know that there's various solutions that we have that can help to address what's happening both here locally as well as nationally.
Yeah, I mean, so you're with the March of Dimes, and just so that if people don't understand, tell us what you guys do and how you're sort of involved in this, and this is one of your sort of main missions.
Yeah, absolutely. So the March of Dimes, we are leading the fight for the health of all moms and babies, and we have a program called It Starts with Mom, and we believe everyone should be healthy before, during, and after pregnancy, so everyone, mom and baby and family, can get the best possible start. This year, we are focusing on bringing education, greater awareness, as well as advocacy for doulas, for low-dose aspirin, for vaccinations, and why that's important for the entire family, as well as in the maternal mental health and the postpartum journey. And we invite everyone to visit our itstartswithmom.org website to learn more about all of these provider and educational resources that are available.
Yeah, absolutely, because I know you said, you know, it's complicated. Obviously, I mean, you guys study it and live with those numbers and work with families. I mean, but is it mostly, is it lack of medical care? I mean, like this population isn't seeing doctors soon enough or at all?
Sure, so again, multifaceted, so let's talk about a couple of things. First one being access to care. So do you have access to health insurance, as well as are you able to see a provider who can see you? And in Texas, unfortunately, if you are a low-income, under-resourced individual, you don't have access to health insurance when you are before you're pregnant or even after you're pregnant, because that ends after 1 year. Medicaid ends. And so we believe everyone should have health insurance and that access to care at all points in their life so that we can help you become healthy before you get pregnant, and then you can stay healthy after you're pregnant. So that's one factor. The other one being we have what we call the social determinants of health. And those are societal factors: where you live, work, do business, where you play, where you worship. And there are various factors that are driving some of those outcomes. So I like to talk a little bit. Let's take the flooding that happened last week, the rain that happened. We know that climate change is having an impact on the health of all moms and babies. We see low birth weight babies as a result of disasters. We see pregnancy loss, unfortunately, as well as say you're in a home that's been flooded and you're exposed to mold. We could then have a higher respiratory illness rate that's then affecting your health.
Wow. Yeah, and it's all sort of tied together. We want to let people know that we're going to link to March of Dimes on this interview on click2houston.com to provide links for some of those resources that you talked about earlier. Alicia Lee, we appreciate you coming in. Thank you so much. This is definitely 2024. We shouldn't be seeing hundreds of women dying while pregnant or after giving birth. We appreciate your time. Yeah. Thank you so much.